Welcome to the deep dive. Today we're looking at something really fascinating, the intersection of digital health tech and psychedelic-assisted therapy.
Yeah, it's a rapidly evolving area.
Definitely. Our goal is to kind of pull out the key ideas from our sources and figure out how these digital tools might, really change these mental health treatments.
Exactly. We've got some great material. There's a white paper from Blue Matter Consulting on the potential here,
Right.
and an article from Frontiers in Psychology that looks specifically at virtual reality, VR, in psychedelic psychotherapy.
VR, interesting.
And we'll also touch on some real-world stuff, expert views from the Psychedelic Therapy podcast.
Great. So for you listening, if you're interested in the future of mental health care, or maybe the potential of psychedelics, or just how tech is changing medicine, well, this should give you some solid insights.
So it's a dynamic field for sure.
Okay, let's dive in. What's the basic reason we're even talking about mixing digital health with psychedelics? Like, what's the problem here?
Yeah, the Blue Matter paper really nails this. Psychedelic-assisted therapy, the traditional way, it's intense. Super intensive.
How so?
Well, think about it. There's all the preparation beforehand.
Right.
Then the actual session, the drug administration day, usually with a therapist, sometimes two, present the entire time.
That's a big time commitment.
A huge commitment. And then there's the follow-up talk therapy, integration, which can go on for weeks or months.
Okay, I see. So that intensity.
It leads to really high costs.
Yeah.
And it limits who can actually access it. It's a major bottleneck.
Right. Hard to scale that model. Makes sense.
Mhm.
So how does digital health come into play? How can it help fix that?
Well, digital health potentially offers a bunch of solutions. It could streamline things, make processes more efficient.
Okay.
It could definitely improve access for people who maybe live far away or have other barriers.
Geographic barrier. Yeah.
And there's potential to boost the quality of care, maybe even lower the costs. And what's really exciting is the possibility for more personalized therapy.
Personalization. Okay. And the Blue Matter piece mentioned how, we already use tech for health stuff all the time.
Totally. They point out how many people were already using health and fitness apps years ago, something like 87 million monthly users back in 2020.
Wow.
And a big chunk of smartphone users, like 62%, were using their phones to look up health information.
So people are already comfortable using tech for health. That's a good starting point.
It really is. It suggests people might be open to integrating digital tools into something as, well, cutting edge as psychedelic therapy.
Yeah, absolutely. And given that psychedelic research is still, relatively speaking, kind of young,
Right.
it makes sense to think about building a better, more holistic delivery system from the get-go.
A more scalable and accessible one.
Okay, so let's dig into the key areas where these two things might work well together. Synergy, efficacy seems like the big one.
Mm-hmm.
Does it make the therapy work better?
Agreed. All the sources touch on this. We already have evidence, growing evidence, that psychedelics, LSD, psilocybin, ketamine, MDMA, combined with therapy, show real promise.
For things like PTSD, depression.
Exactly. PTSD, depression, anxiety, substance use issues, even OCD. Pretty significant results in some trials.
And the Frontiers article points out that digital therapy, just on its own.
Yeah, digital psychotherapy delivered online or via apps has been shown to be pretty effective too. Often just as effective as traditional face-to-face therapy for similar conditions.
So the really interesting idea is what happens when you combine them? Can digital tools actually enhance the psychedelic experience or the outcomes?
That's the core question, and there are some specific ideas. The Blue Matter paper talks about VR, virtual reality.
Right, you mentioned VR earlier. How would that work?
Well, one idea is using VR for preparation, helping people get ready for the kinds of sensory changes or distortions that can happen during a psychedelic state.
Ah, like a practice run.
Kind of, yeah. They called it a psychedelic flight simulator almost, to help people get comfortable with altered states beforehand.
Okay, that could reduce anxiety going in.
Potentially, yeah. And maybe increase how receptive they are to the therapy. Another idea is using VR during the session itself.
To control the environment.
Exactly, to create and optimize the therapeutic setting. Maybe researchers could figure out what kinds of environments are most helpful.
And then recreate them in VR.
Precisely. And that Frontiers article dives even deeper into VR. It mentions studies suggesting VR itself can sometimes induce experiences that feel transcendental or mystical.
Really, similar to psychedelic experiences.
Similar in some ways, yeah. Which opens up possibilities. Could VR not just prepare you, but maybe even, deepen the therapeutic effects?
Create a specific kind of supportive virtual space during the journey.
Exactly. And the Frontiers article also stresses how important relaxation is before and during the session for good outcomes.
And VR is good at creating relaxing environments.
It can be, yeah. It offers reliable ways to guide someone into a calm state. Pretty powerful.
Makes sense. The Blue Matter paper also brought up mindfulness and meditation training.
Right. Another area with potential synergy, they note that both mindfulness practices and psychedelics can lead to altered states of consciousness.
And both seem to have antidepressant and anti-anxiety effects.
Exactly. There's overlap in the phenomenology, the experience, and maybe even the underlying brain mechanisms. Combining them could be really beneficial.
And music therapy, too. That's often a big part of psychedelic sessions.
A huge part. The white paper highlights how central music is for the emotional journey, the imagery, the self-exploration that happens.
And we're seeing tech used here already, right? Like Field Trip, working with wave paths.
Yes, that's a perfect example. They're using AI to create adaptive music.
Adaptive how?
The music changes in real time, based on the patient's state or maybe input from the therapist to support the process.
Wow. Tailoring the soundtrack to the journey.
Pretty much.
Yeah.
Helping guide emotional processing. It shows how tech can be woven right into the core experience.
Okay, so boosting efficacy is one major angle. What about the access and efficiency problems we started with?
Yeah, this is crucial. As we said, the therapy part, the behavioral therapy, is essential. But getting access to therapists trained in this, that's historically been tough.
And expensive.
And expensive. So digital tools can bridge that gap. Telehealth makes therapists more accessible regardless of location. You can deliver parts of the therapy digitally. Even just providing good information online about psychedelic therapy can help reduce stigma and let people learn more.
So if you're curious or struggling to find support, digital avenues could open doors.
Absolutely. It's about making it easier for more people to connect with these potential treatments.
Democratizing access, in a way.
Exactly. And it's not just about connecting patients and therapists. Digital tools can make the whole process run smoother.
Like the logistics.
Yeah. Remote patient monitoring, checking in on people between sessions via apps or wearables, automating appointment scheduling, tracking progress,
Secure messaging between sessions.
all of that. These platforms can streamline the workflow, make it more efficient, and hopefully bring down costs. Blue Matter mentioned New Life Health's platform for ketamine therapy as an example.
And we heard about that model on the Psychedelic Therapy podcast, too, didn't we? From New Life themselves.
We did. Juan Pablo Capello discussed how their telehealth and app-based aftercare model works in practice, real-world application.
So it's about optimizing the whole ecosystem around the psychedelic session, not just the session itself.
Precisely, which leads nicely into the third area, data and personalization.
Right. This seems key, especially since psychedelic experiences can be so different for everyone.
Totally, because responses vary so much. Getting good real-world data from patients is vital to move the field forward.
And digital tools are perfect for that.
Absolutely. Collecting patient-reported outcomes, how people are actually feeling and functioning through apps or surveys, wearables, tracking sleep or activity levels.
Capturing the individual experience.
Yes. And that data isn't just for researchers in the aggregate.
It can feed back into individual treatment.
That's the goal. Understanding how you are responding can help tailor your therapy plan, optimize it, ensure continuity of care.
Like creating a sort of digital psychedelic profile to guide treatment.
That's the direction things seem to be heading. Blue Matter pointed to MindMed's Albert division. They're building a digital platform and even have patents related to personalizing MDMA or LSD dosing based on individual factors.
Tailoring the dose and maybe other aspects of the therapy.
Exactly. Moving away from a one-size-fits-all approach. And then there's the idea of digital biomarkers.
Explain that a bit more.
So measurable indicators gathered through digital tools, maybe patterns in your voice during therapy calls, how you interact with an app, your sleep data.
Things that might predict how well you'll respond to treatment.
Potentially, yes. A bit like how a blood test gives doctors information. Atai Life Sciences, through their Introspect division, is working specifically on this.
Using digital biomarkers to predict recovery paths.
That's the aim. It could help streamline therapy, maybe reduce the trial and error, and get people the most effective treatment faster.
That feels like a potential game changer.
It really does.
So, it's clear that companies in this space aren't just making drugs. They're actively building digital components. Let's talk specifics. Field Trip, we mentioned them.
Right. Field Trip has their Trip app, which is free. It offers guidance for people using different plant medicines, so it broadens access to information. Plus mindfulness, breathwork exercises,
And the wave paths, music collaboration.
and the wave paths, AI music, a multi-pronged digital strategy.
Then there was Entheo, digital, and sound self. We heard about that on the podcast.
Yeah, that was a really interesting discussion with Robin Arnott and Sandy Prakash. Sound Self uses audio and visuals to induce states that feel somewhat psychedelic.
So it could be used for prep.
For prep, yeah, maybe help enhance outcomes, keep people engaged. And they suggested it might even ease the training burden for therapists for certain preparation phases.
Interesting. And MindMed's Albert division sounds like they're building a big digital ecosystem.
Very much so. An integrated platform to support all their different psychedelic drug programs.
The personalized dosing patents.
Right, and they acquired Health Mode, an AI company for clinical monitoring, and partnered with BioXL on identifying agitation. It shows a deep commitment to digital integration for optimizing treatment.
Atai Life Sciences, with Introspect, also seems convinced about combining digital tools with the therapies.
Yeah, Atai strongly believes digital combination therapies are key for better safety and effectiveness. They're focusing on remote monitoring, digital integration, counseling to improve access.
Especially for remote or underserved populations.
That seems to be a big focus. And again, their work on digital biomarkers is central to their approach, predicting recovery, streamlining things.
And New Life Health, back to them, the telehealth ketamine provider.
Right. A clear example of using telehealth for delivery and then integrating virtual aftercare through their app addresses both access and the crucial integration phase.
Okay, so lots of activity integrating digital tools broadly. Let's zoom back in on VR for a moment, since that Frontiers article focused heavily on it.
Yeah, it really highlighted some compelling aspects of VR. As we touched on, research suggests VR can actually induce experiences that share qualities with mystical or transcendental states.
Which are often linked to good outcomes in psychedelic therapy.
Exactly. That finding alone is pretty significant. VR potentially mimicking some key subjective effects.
Beyond mimicking, what else?
Well, the relaxation potential we discussed. VR offers reliable ways to guide people into calm states, which seems really important for managing the anxiety that can come up.
And VR isn't just experimental, right? It's used in other medical areas.
Oh, yeah. The article mentions its use in pain management, even for severe burns in kids. Also in stroke rehab for cognitive and motor recovery.
So it has a track record in serious medical applications.
It does, which lends credibility to its potential here. And studies are looking at using VR to augment other therapies, too.
Like exposure therapy.
Yes, the Frontiers paper cites studies on VR-enhanced exposure therapy for PTSD and social anxiety.
Suggesting VR can make existing therapies more effective.
By creating these controlled virtual environments for therapeutic work, yeah. It points to a broader potential for VR to mesh with different mental health treatments, including psychedelic ones.
Okay, so there's clearly a lot of excitement and potential. But what are the cautions? What do we need to keep in mind moving forward?
Well, the Frontiers article is clear. We need more research, specifically on combining VR and psychedelics for different conditions, different groups of people. It's still early days for that specific combo.
Understand the nuances better.
Exactly. And the real-world data collection across the board in psychedelic therapy.
Keep learning from actual patient experiences.
Absolutely. That's critical.
It really does feel like we could be on the cusp of a major shift in how we approach mental health care, though, with digital playing a huge role.
I think so. This convergence could lead to a much more integrated, maybe more holistic, and hopefully more equitable way of providing mental health support.
It could even change how we pay for and measure these services.
That's a real possibility down the line, reshaping the whole landscape.
All right, so let's try to wrap this up. Key takeaways from our deep dive. Digital health looks really promising for making psychedelic therapy work better, reach more people, and become more personalized.
Definitely. We're seeing tools like VR, mindfulness apps, AI-driven platforms like the music one already being tested and used.
It points towards a future where mental health care is much more integrated with technology.
Yeah, potentially much more effective because of it.
So, a final thought for you, the listener. As these two powerful fields, digital health and psychedelic science, keep merging, what new opportunities might pop up? What challenges will we face?
Right. Especially think about balancing all this cool technology with the core human element of therapy, that connection between therapist and patient. How do we keep that central?
That's a great question. Finding that balance will be key. Definitely a space to keep watching.